Welcome to Introduction to Science and Health Communications, Part 2. We've looked at what science and health communication is, why it's important, and who does it. In Part 2, we'll examine another challenge and also look at the process of science and health communication. How does it happen? For the non-scientist or non-health professional, health and science information disseminated through the media and the internet can often be confusing and contradictory. Let's take a look at an example. On January 1st, 1998, the New England Journal of Medicine published a study about the impact of weight on lifespan. Many newspapers across the United States published stories based on this study. The New York Times ran the story with this lead. The largest study ever conducted on health risks of obesity has found that it increases the likelihood of premature death, but not as much as many medical experts had expected. On the same day, a small-town paper ran the story off the Associated Press wire with this lead. Is keeping down your weight a New Year's resolution? Here's some incentive from the world of medicine. One of the biggest studies ever to look at the effect of weight on longevity concludes that thinner is definitely better at almost all ages, including well into middle age and beyond. Looking at these two leads side by side, there is clearly a different approach to the story in each newspaper. It could be said that one presents the information in a positive light, attempting to engage readers, while the other takes a more factual approach, simply presenting the study findings without dressing up the delivery. These types of variances in communicating science or health information is another important challenge to be aware of when producing communication pieces, but also as a consumer of mass information put out by media. So how does it happen? How does science or health news get from the scientists to the public? The starting place for most science and health news is the academic journal. Journals like Science and Nature publish articles that eventually lead to stories in mainstream media. For example, a scientist does a comprehensive study of populations and discovers that obesity causes an increased likelihood of premature death. He writes an article about his study and submits it to a journal. His article is reviewed by peers in his field to ensure the validity of the study. If the article is approved by the scientist's peers and the journal, it gets published in the journal. Journalists use these peer-reviewed health and science journals as a source for their stories. Where else does it come from? Press releases. A scientist does a study. They or their organization write a press release about it and send that release out to the media. Press releases come from all kinds of science and health organizations, including research, educational, private, and public. The media then either use the press release as is with little or no change, or they write a story based on that press release. What this means for science and health news is that science journalists are being cut out of the picture, and often that is a specialized journalist who produces quality stories that are accurate and engaging to the public. There is a debate in the field of science communicators and journalism about what effect this will have on the quality of science and health news. With the evolution of the internet, another source for science news has quickly gained ground: scientists' personal blogs. In 2004, 18% of journalists got their story ideas from scientists' personal blogs. In 2009, 63% of journalists got their story ideas from scientists' blogs. That's a significant increase. If you are a scientist or a health professional yourself, or even just an individual with a knack for writing and a passion about your field, blogging has become a very effective way to join the ongoing public discourse in that virtual world we call the Internet. This is the end of Part 2. In Part 3, we'll tackle the big topic of how you can practice effective science and health communication.